provide bradycardia, okay, as opposed to tachycardia. And in asthmatics, okay, they could cause bronchoconstriction because they're not selective. So propranolol, given as a beta blocker for people with high blood pressure that also has asthma, is not good, okay? Whereas a specific beta blocker, okay, that's specific to just the beta blockers in the heart, okay, they have more activity in blocking the vasoconstriction on the blood vessels, as well as the vasoconstriction constriction on the heart muscle. They will have fewer side effects and not cause the bronchoconstriction of the lungs. I have a friend who has asthma and has high blood pressure, and she takes atenolol, okay? Because in taking propranolol, that would cause her to have more of an asthmatic reaction. There are those that block both the alpha and the beta receptors, okay? And those end in alol. And a good way to remember that is that they're alpha and beta, okay? And there's an A in the name. Selective alpha blockers and non-selective beta blockers are a drug like labetalol, okay, for hypertension. It lowers the blood pressure, and it doesn't have reflex tachycardia. So that's a good thing, a specific drug. These are just examples of how they could block one or block the other, be more specific, and not cause other adverse effects for people that have that problem. There are actually neuromuscular blocking agents, okay, that affect that transmission to the skeletal muscle. Remember the nicotinic receptors? That's why we learned about that, okay? And they can be used as antagonists or as agonists, depending on what kind of effect you want to have. And we already talked about some of these, okay? The curare, right? That causes paralysis of the muscles involved in breathing, okay? And somatic, okay? And they are competitive, okay? They're competitive blockers that can be, you can actually administer an agent to overcome them, such as neostigmine, okay? And this would be a drug given to counteract the effects of the cholinesterase effects on the agents, okay? So curare that we talked about before. And that's really it for us for now. The drugs that I gave you here are some